Been doing a lot of work with metabolite called oxaloacetate. You've probably heard about it in high school biology class. It's part of the Krebs cycle, and it's one of the lowest in the Krebs cycle. So it acts as a regulatory molecule, and it's absolutely critical for energy formation. Now, Cornell University did a study on ME/CFS patients and normal controls, and one of the things they found that oxaloacetate was significantly lower in the blood plasma of ME/CFS patients. And we've done a lot of cellular and animal work in oxaloacetate and found some interesting things that may apply to ME/CFS patients, including the reduction of chronic inflammation because of the NF-kappa B pathway that takes a protein in the cytosol and transposes to the nucleus and then turns on the cytokine cascade that helps with inflammation and healing. Well, oxaloacetate can turn down that chronic inflammation by about 70%. We also see a reduction of the Warburg effects. Otto Warburg, who worked in this building, saw glucose coming into the cell and being fermented in the cytoplasm instead of being pushed to the mitochondria. In the last 5 years, it's been shown that oxaloacetate in the cytosol can reverse the Warburg effect, which is really exciting. We also see an increase in the NAD to NADH ratio, which was shown by Hans Krebs, and we see an increase in PGC1 alpha, which facilitates mitochondrial biosynthesis. So we're making more mitochondria. And we see an increase in cellular glucose uptake, not only in animal models, but in clinical trial in diabetics. So we're bringing in more glucose, directing it to the mitochondria, giving you more mitochondria, producing more energy, and then using less of that energy for inflammation. As a proof of concept trial, we had 76 patients with ME/CFS. We tried 3 different doses of oxaloacetate, 500 milligrams twice a day, 1,000 milligrams twice a day, and 1,000 milligrams 3 times a day. Our patients average about 8.9 years of illness, and they saw about a 33% reduction in fatigue that was highly significant at 6 weeks. We followed that up with 2 RCT double-blinded placebo-controlled trials at the Bateman Horne Center. For the control, we used white rice flour because we're using this as a medical food in the United States, so we wanted to compare it with another food. And what we saw is the control group quickly dropped off. It took about 3 months, though, to completely get rid of the placebo effect. The oxaloacetate group decreased fatigue anywhere from 27 to 35%, and it was all highly statistically significant over baseline. We were significant over placebo. We ended up at 0.057, which when you see that as a designer of the trial, you go, ah, shucks. This is a Fourier transform of the fatigue scale data. The vertical scale is the number of patients that have this particular score. The score is the start of the study minus the end of the study, so how they've changed over 3 months. This is just the control group. What we see is most of the patients stayed the same. If they came in at 5, they left at 5 or whatever. Some patients got better. A lot of patients got worse, and this is the crash that you want to always avoid. If we superimpose the oxaloacetate graph over that, what we see immediately is that a large portion of the patients, this is a 25% improvement line, so they're doing better than 25% improvement. It turns out that's 40% of the patients that tried this, and their average response was 63% reduction in fatigue. Now, we also see on this side of the graph, there's no crashing. So after 3 months, we're seeing no crashing in the oxaloacetate group as compared to the control group and this enhanced responder group. And when we look at the number of patients in the enhanced responder group, we can see it's twice as many as the control group, and it's statistically significant. So we also looked at cognitive function, and we used the U.S. Navy's Defense Automated Neuro Assessment for testing. This is a validated test for neurocognitive testing, and what we see in the baseline fluctuates around 0% change, which is what we'd expect with white rice flour, whereas the oxaloacetate group sees a highly significant improvement in cognitive function. And it's the entire group. It's not just an enhanced group. It's the entire group has seen that improvement. Now, we also ran a clinical trial in long COVID. With this cognitive function trial, we, again, with the white rice flour, we see about a 0% fluctuation from the mean here. But with oxaloacetate, we see significant improvements in cognitive function, reducing one of the big things in ME/CFS and long COVID, brain fog. Now, oxaloacetate's well tolerated. We did see a small increase in GERD-type symptoms, but it was very manageable. We significantly increased energy and essentially eliminated crashing at the 3-month mark, increasing quality of life. We significantly improved cognitive function in the entire group in both ME/CFS and long COVID. And 40% of the oxaloacetate group were enhanced responders with a 63% average improvement in fatigue. Based on this, FDA allowed us a structure function claim. Oxaloacetate may help alleviate physical and mental fatigue symptoms associated with myalgic encephalomyelitis, chronic fatigue syndrome, ME/CFS. So this is the first medical food that is commercially available for the treatment of fatigue with ME/CFS patients. And I'm sure after hearing many of these presentations, we'll see many other treatments coming online soon. Thank you.